towards the west of Sittingbourne is two little villages, Bobbing and Hartlip, and at Bobbing we have Demelza House, which is a children's hospice for largely with people kids who've got sadly very sad cases of cancer. And I have helped Demelza House over the last 10 years. When Richard Oldfield was chairman, he was concerned about the future funding of Demelza, and I brought him to see Lord Hunt, who was the Minister for Hospices. We tried to see whether we could engineer some NHS funding for the trust, but in the end, because we changed the rules on the lottery, I brought the chief exec of the lottery down before actually we had announced the changes. So when the changes were made and we could then bid for hospice and cancer through the lottery, Demelza put in very quickly its bid and won £600,000. So again, it's all part of doing the partnership, working with the different organisations, and bringing the government bit or the agency bit from London down, just to make sure that we're all singing from the same hymn sheet, so that when we apply for money we get it. And it's really, that's the hidden work of being the MP that people don't see. Suddenly you hear we've won 19 million or we've won 600,000, you think, wow, but actually nobody fully understands the amount of work that takes. And I need fantastic staff, which I've got both here and in the constituency, and without their hard work I frankly wouldn't be able to do these things, because in the end they're the ones that do the research, find the information, get me the the diary appointments, and I'm the one that bash the ministers and say, come on, we need the changes. So Demelza's the most wonderful thing, and they've now merged and they're trying to think for a new hospice, I think, in South East London too. It's an extraordinary thing that's happened there at Bobbing. When I look over the 10 years as being the MP, I think there are two other things that have really changed. First of all, the hospital at Sittingbourne Memorial Hospital. When I came in 1997, we had 2 wards, but the Conservatives couldn't afford to open the wards. And one of the first things I did was to make sure we opened the wards. We're changing a little bit of the policy about how we deal with people who are ill or not ill, and so there is some further work to be done at the hospital, but at least it's working, and it's a very good community hospital. In terms of our GP surgeries, we've had the most spectacular one built at Iwade. I wish we had more. We have another sensational one at Grovehurst Surgery at Kemsley, and we need more. But when I see the changes and the changes coming through on the health, I'm really encouraged. We're going to spend something like 9% of GDP. It's higher than France and Germany and Italy. We've got some issues. I don't doubt that, and put my hands up and say it's not easy. But the health service employs more people than any other organisation in Europe. Third largest employer of people, 1 million or so. So it's third. I think first is the Red Army in China, and second are the Indian railway workers. So you can see the size of it, and trying to turn it around as a big juggernaut is difficult. But I'm really pleased to see the changes that have happened in health, and we've got a record amount. We had a record amount 2 years ago, 15%. I see we've got 24% increase in the next 2 or 3 years, which is terrific because we need it. But again, it's about putting the resources. We said in 1997, education and health, and boy, we have certainly put the money in. We've got some issues, like all governments. It's not plain sailing, but I'm pretty chuffed with the way things have gone. On the school side, I must compliment the head teachers. They've done an astonishing job at primary and secondary level. Highstead is now I'm not sure if it's certainly one of the best in Kent, and its GCSE and A-level results are second to none. Borden is improving, but probably got more to do. If you look at the secondary schools underneath there, whether it's Fulston or Westlands or Sittingbourne Community College, changed out of all recognition. New halls, new music centres, new brickwork, new computer suites. It's terrific to see the hard work and dedication of the heads who've done remarkable jobs. And the same with the primaries, where we've asked a lot of our teachers and staff, but our results are really encouraging. And we didn't in 97 had India and China coming over the mountains, as it were, but in the next 10 years the skill level of the world is going to change, and we've got to have a flexible enough workforce to be able to compete and change too. And that also is going to be, I think, that one of the battlegrounds of the next general election.